Well, in this afternoon's health alert, the CDC is warning that we're likely in for another rough season for respiratory viruses. During peak virus season, the agency predicts up to 25 new weekly hospitalizations for every 100,000 people. Experts say COVID will be the worst perpetrator, followed by the flu and RSV. So to talk much more about the upcoming cold and flu and COVID season, ABC's medical correspondent Dr. Darien Sutton is here now to talk much more.
Good to have you with us, Doctor.
Thank you for having me.
The symptoms, though, are pretty much the same for all three, right?
Pretty much the same. It's really difficult.
If we're at home, how do we tell the difference between RSV, COVID, flu?
I wish I had an answer to this. If I did, I probably would be able to retire today. But unfortunately, there is no easy way to tell. The symptoms, the flu-like symptoms, we qualify for all: RSV, COVID, and the flu. Honestly, as a physician, when I'm testing a patient, I'm waiting eagerly, just as curious as the patient is. And so what I would say personally is when you feel those symptoms, that cough, that sneeze, that runny nose, first off, isolate yourself from those high at risk. If you feel like you can treat yourself from the comfort of your own couch, do just that. Basic things that we all know to be true and well. Wear your mask outside, especially if you're outdoors, and get tested to understand what you have, just to be sure.
Okay. Because they can test for the flu as well as COVID and RSV. Let's talk about the RSV for a second, because I think parents are really encouraged that there's a new vaccine for it for young kids, but now we're hearing from the CDC it's in short supply. So what should parents, how worried should parents be?
So there's a lot of discussion on this RSV treatment. In reality, it is actually a RSV monoclonal antibody. And so it's similar to a vaccine in which we give it as a shot, but it basically works by helping to protect that child's immune system from the infection. And it's meant to be given to children under the age of 8 months, which is the most dangerous period of time for a child to be infected with RSV. In the meantime, while we see this shortage of this helpful, protective monoclonal antibody, I advise parents to the basic protocols for protection: washing your hands, cleaning high-touch surfaces. And I personally believe that children are high risk, and so I'm more inclined to wear a mask around a child, for example, that I do not know, to decrease my risk of transmission of an infection. Precautions all the way.
I'm still confused as to whether or not it's safe to go get my flu shot and my COVID shot at the same time.
It is.
It is?
Yes, absolutely.
All right, well, that clears that up. And Moderna is now entering clinical trials that would have a combination vaccine for both COVID and the flu?
These are fascinating clinical trials that are going on, because they not only will improve the efficiency in getting these vaccines out to those who need it, but also accessibility. Who wants to plan and try to figure out how to get 2 different vaccines? Aside from that, they also have new research that is currently under approval, possibly for a possible flu vaccine that you can get at home. And so the future is that you might not have to wait in line at the pharmacy. You might be able to get that flu nasal spray at home, where you can just use it to help protect yourself.
Yeah, we talked about that.
That would be nice and easy, especially since it's not a shot.
Exactly. I think more people would be happy to know that that is not a shot.
Yeah, in the comfort of our home. Doc, a pleasure.
Thank you for having me.
Appreciate it.
Thank you so much. We really appreciate it.